this meeting to order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on September 20th, 2016. Minutes of the special trustee meeting on September 20th, 2016. And a check report September 8th, 2016 through October 7th, 2016.
I move the approval of the consent agenda.
Second.
I have a motion by Dr. Brown, a second by Darlene Sanderson to approve the consent agenda as it is presented. Roll call vote, please.
Jasper.
Yes.
Hannaford.
Yes.
Sanderson.
Yes.
Simon. Yes. Brown.
Yes.
Klein.
Yes.
All right, the next item is the CEO's report. Candace?
All right. As you remember, Jennifer Nichols is the newest nurse practitioner that we have that works in our urgent care. Jennifer is also taking regular appointments. Lynn did a really good article in the paper about Jennifer, I don't know, a couple weeks ago. She's been doing a great job. Her turnaround time with our urgent care patients we're very pleased with. She jumps in if Dr. Lawrence gets running behind in his clinic because he sometimes steps over to the ER to help with more critical patients over there. Jennifer can step in and keep his patients on track, so that's been working well. So kudos to Jennifer for stepping in there and doing a great job. Both Kinsey and Lawrence clinics have been staying pretty busy. The downtown clinic, the mid-levels went to Rotary?
Yes.
To Rotary.
Yes.
The three of them went to Rotary, and the clinic is picking up downtown. In fact, I had to buy them lunch today. They hit their goal. Their goal was 42, and they had 44 patients yesterday, so they had Chinese food today. So very proud of them. You can see we've hired quite a few new employees over the past month or so. Your quality assurance reports are attached. The LMHP Telemed, that is a licensed mental health professional that can do assessments for mental health patients that need assessed and or placed in a facility. Those are very hard to come by, and we were able to hook up with the Oklahoma Department of Mental Health and Northwest Center of Behavioral Health to make that happen, so we can do that via telemedicine now. We're hoping that will go more smoothly for us and get a quicker turnaround to place those patients instead of holding them until we are able to find a bed. Sometimes that can take a very long time. Surgery was up quite a bit this past week. We have been pushing the physicians and surgeon to do more procedures and get the word out about those procedures that we are able to provide here at Shore Medical Center. That is a revenue stream that we don't want to see go away, so we need to get the volumes up in that area. We finally got our new IV pumps, and we're pretty excited about that, and a new EKG unit for the nursing floor. Dr. Mullins was here, and as always, she stays pretty busy, considering she's only here 3 to 4 hours when she comes. She saw 17 patients last time. We are continuing to have the Northwestern nursing students, the juniors, do their clinical rotations, and they'll be assisting with our flu shots for our employees and other. If you guys want flu shots, be happy to give you flu shots as well. It's been great. We've been busy, and so that they've got a lot of experience here, which seemed to tickle Jennifer to death that they were staying that busy. And lots of guys in the program. That's what tickled me. We need more male hormone around here. Upfront collections down, but staying about the same as I think as it was last month. Is that right, Heather? We have one, Shawnee Thel, we've hired for She's precepting for free right now in Dr. Lawrence's clinic. She's a graduate nurse who, crossed her fingers, took her test today. So we're hoping that she did well on her test and she'll be helping out in his clinic. You can look back through, a lot of times I don't catch this when they put their statistical information, but you can look back through the graphs and see comparatively month over month how we're doing with the patient volumes. Miscellaneous, oh my goodness, the phone service. If we could have reached out and choked somebody from AT&T, and yes, you can put that online in the paper wherever you'd like to. I don't think there is a person to choke because I think we could have found them. We were down and out intermittently for over 2 weeks. But knock on wood, hopefully they have found that glitch. I think it was a splice in the line. They finally found it and we're back up and haven't had any problems so far. That's painful. It's so hard because we've got so many faxes, let alone the phone calls, but the faxes that get missed, or you think you sent it and it didn't get sent, it didn't get through, so it really did create a lot of backlog for our staff. Kevin and I met with Chris Murphy from BKD regarding the UPL program. We met with 2 different owners that have a total of 3 nursing homes, and have talked to a 4th one as well. So that would be 5 homes altogether that we're looking at just currently with the UPL program. Tentatively, January of 2017, who knows at this point, it keeps changing, so we're just impatiently waiting for that to happen. One more thing, Lynn Moran, our risk management consultant from Plyco, was here to do an external audit of our risk program. Had a few recommendations for us to implement, but overall that went well. As you probably have already been hearing in the community, we are continuing to look for more and more ways to control costs and be more efficient with the money that we have. You know, with tax dollars down and everything else, it makes it tough. So please know that we are continuing day after day to work on those things. That's why we have 3-hour finance meetings. I don't have anything else. Oh, I should mention Dr. Lawrence and his wife were in a car accident. They are okay. It was a horrible, terrible accident. He is hoping to come back Thursday. He has a light schedule on Thursday and is hoping to come back and do that. His wife had a broken bone in her leg that they repaired, and he's got his left hand he's not able to use at this point, but they were very, very blessed to have made it through a rollover accident in a Jeep Wrangler. So it was pretty scary, but hopefully we'll get them back soon. She scribes for him, so it's been a little rough. But Jennifer, she's jumped in there seeing these patients for the most part. We haven't canceled or moved very many appointments, so it's been good to have Jennifer there to help him out so he can stay caught up. Do you guys have any questions for me?
What about it? Wasn't in here, but EHR, I know we talked about it a little bit in finance, in regards to, hopefully this next month.
Yeah, I was talking to Melissa. It'll probably be January before we can do it because it's 365 days, so we have to get to December 31st before we can attest.
Okay.
So.
All right. That's just that next phase. With that, once you attest, then you're granted some money to help come back for doing that. So, all right. Any other questions for Candace? If not, I would entertain a motion, please.
Motion to accept the Sheriff's Center report for October 25th, 2016.
Second.
We have a motion by Terry Klein, a second by Dr. Hannaford, to approve the Sheriff Medical Center written report for October 25th, 2016. Roll call vote, please.
Hannaford,
Yes.
Sanderson,
Yes.
Simon,
Yes.
Brown,
Yes.
Klein,
Yes.
Gasper.
Yes. Candace, thank you. Next is the CFO's report. Kevin?
Sure. Before I go over the monthly report, I'd like to introduce Carly Williams with BKD. He's here tonight to just kind of give a presentation of the audit report of what they found so far. And so with that, I'll turn it over to him, then I'll go do my finance report. So,
Okay, great. Thank you, Kevin. Thank you all for allowing me to be here tonight, go through a draft of the financial statements with you. You should have the documents in front of you. There'll be a bound set of financial statements and then also a stapled management letter. You should also have a printed out PowerPoint presentation. That is what I'm gonna work from to keep us on track. But if you have questions, anything you want to dig into on the individual statements themselves, just let me know and we'll do that. As in years past, I was here earlier today for the Finance Committee. As you heard, it was a lengthy meeting. I promise I didn't take up all the agenda time on that. But we did go into discussion of the audit at a very detailed level, walked through numerous different items. So the board presentation will be much more high level. But again, if you have any questions, please feel free to ask. The audit is in draft form, as we always present it in draft form to give management and the Board of Trustees the opportunity to look through the audit and answer any questions before we finalize. We are substantially complete with our procedures at this point. Don't anticipate any number changes, just have some final wrap-up items that have to be done within the last couple of weeks before we issue our final reports. We did not have any scope limitations during the audit, and no difficulties in completing the audit. We are going to be issuing an unmodified or clean opinion. There will be an emphasis of matter again this year related to going concern, just due to the recurring operating losses. That'll be in the accountant's report, but other than that, no issues with the audit. Like I said, we reviewed the management letter and segregation of duties issues in detail at the Finance Committee. We also looked at the adjusting journal entries in detail at the Finance Committee as well. You do have a summary of the balance sheet and income statement on page 2 of the PowerPoint document, or feel free to follow along in the financial statements if you prefer. What I've done here is pull out the balances for 2016, 2015 to reflect on here, and then also computed the dollar change and percentage change so we can talk about any significant swings. On the balance sheet, the major item that changed was estimated amounts due from third-party payers. That's going to be due from CMS, the Medicare system, on your cost report settlements. You do have a receivable that is being reflected on the cost report again this year. But last year, during 2015, you had a large receivable recorded for electronic health record incentive funds that had not been received yet. That's a much smaller number this year. As Kevin mentioned just a minute ago, we'll be attesting sometime in later on in the current fiscal year for the next go-around of electronic health record incentives. No other major significant changes on the asset side of the balance sheet. On the liability side of the balance sheet, accounts payable is up about $138,000 due to timing and some other cash management issues. No new debt that was taken out, so just continual servicing of the existing debt as required. On the following page is the summary of the income statement. No significant change in the net patient service revenue year over year. Other revenue decreased about $381,000. Again, that is predominantly due to a decrease in the electronic health records incentive payments that were received. That is a regressive payment over multiple years, and so that ticks down year after year. Salary, wages, and employee benefits were up about $261,000, predominantly due to increase in FTEs year over year, and then also an increase that was incurred in employee health insurance premiums. Purchase service professional fees didn't change significantly. Supplies and other actually went down. And the appropriations from the city was down about $445,000 year over year. So all these changes ultimately lead to an $848,000 loss compared to a $90,000 gain in 2015. Any questions on the highlight of the financials before I move into the metrics and comparative information? Okay, 3 here, I do have some 3 years worth of historical financial information from the hospital, and then I also have 2 benchmarks. The furthest right benchmark on the graph is all Oklahoma hospitals. The second one in from the right is going to be other rural hospitals across the United States that are less than $90 million in net revenue. That's a big range, but that is actually the smallest benchmark that they provide for us now is anything 90 million and below. On the days cash on hand, all sources, this will take any cash and investments and look at the reserves of cash that you have on hand, divided into the number of, when you take your total operating expenses divided by 365 days to come up with the average daily expenditures, you have about 23 days worth of cash on hand. That's fairly comparable to 2015 and downward trend from what you see in 2014 and prior. Definitely comparable with the other rural hospitals that are out there as rural health continues to struggle. Following page, days revenue and accounts receivable is going to measure the average turnover time that it takes you all to collect your receivables. Last year you were at just under 45 days. This year you're at 47 days. So holding fairly consistent, and in my perception, you're right in the middle of the 2 benchmarks. So you're in a good position from that standpoint. Your current ratio ticked down from 0.8 to 0.6 in the current year. That's below the averages. However, it is worth noting that there is a receivable, or a note payable on the books that is not likely to be paid, just has not been forgiven at this point, and that is dragging down the current ratio to something less than 1. If that was excluded, we'd be more in line with the averages out there with the benchmarks. Average age of plant continues to remain fairly consistent at 12.2 years, and you're right again, right in the middle of the 2 benchmarks. The following graph is the operating margin. That has ticked down again in 2016 to a negative 16.8 as they continue to have kind of slumping net revenue and slight increases in expenses there. So continue to be a challenging time. But you can also see that with the benchmarks from the other rural hospitals of almost 10% negative, and then Oklahoma hospitals just barely breaking over even as an average. The next page, the contractual allowance percentage. I like to look at this benchmark just to see if there's major fluctuations year over year or if this is fairly consistent. And as you can see, for the last 3 years, your contractual allowance percentage has been holding pretty steady at just right under 50%. So no cause for concern there. Like I said, fairly high level at the board meeting. We went into a lot of detail at the finance committee today, but I'd be happy to take any questions that anyone has. Hearing none, I thank you for the opportunity to be here and present. I understand you may not get on with the agenda, so I appreciate that, and if anybody has anything, just let me know.
Thank you.
Thanks.
Sorry, thank you for spending the day with us.
Absolutely enjoyed it. But
At
with
least
that
we
said, I
fed
will
you.
bow out. I will hit the road. Yes.
Well, have safe travels.
Thank you. Thank you very
Watch
much.
for deer if you're heading west.
Yes, exactly.
Okay, we'll go ahead and go over the September financials. For the month of September, we posted $1,843,046 of revenue. That was a decrease of $105,869 compared to the prior month. Every entity that we had seen decreases in revenue. The hospital's revenue decreased by $75,023. The nursing home decreased by $12,937, and the homestead decreased by $17,908. Total patient days were also down in September compared to August. We had 91 in September and 134 in August. Total clinic visits for September was 1,466 compared to 1,431 in August. Nursing home average daily census for September was 53.6 compared to 54.2 in August. Hospital contractuals less bad debts and charity care for September were 54% of gross patient revenue. accounts written off to collection agencies for September was $69,249. Charity care for September was $1,090. Operating expense excluding salaries, benefits, depreciation for September totaled $466,052, or an increase $56,555 compared to the prior month. We had a net operating loss for September of $287,700 and a net loss after sales tax of $208,615. If you flip over to page 2, of course that's all your the income statements of the combined thing. The one line item I do want to point out is the insurance expense. You'll notice that was up about $16,000, and that was due to the fact that we needed to purchase some tel coverage for Dr. Smith that has left, so that was just a one-time deal, and that will cover us for any claims that may arise later on or at all. The other thing is the supplies expense was up about $50,000. That was in the nursing home. There were some expenses that should have, about $15,000 to $20,000 should have happened in the prior month, but we didn't get it in before the month end closed. So that's probably should have been an expense in the last month that were actually in this month as well. So if we turn over to page 4, you can see last year at this time, we only had booked $5 million worth of gross revenue. We're up to $5,525,000. This year we're about $500,000 from where we were for the first quarter. Net revenue, we're up about $70,000. We're at $2,859,000 this year. Our net operating loss this year compared to last year was $655,392. Last year we were at $486,360. And after sales tax and contributions and stuff, year to date we're at a net loss of $437,559 compared to $167,232. The next page is the hospital's income statement. You can see, like I said, we were down about $70,000 from the prior month. Expenses were up. A lot of it is in salaries and stuff, and part of that is due to the fact that with Dr. Lawrence and covering the emergency room and stuff, and we also had some people that we had to pay out vacation time to. That's a once and done deal. But we did see that increase there go up, and it should actually in the next few months actually see go in the other direction as well. Otherwise, the rest of the expenses were pretty much the same as they were in the prior month, and like I said, we lost $166,140 after sales tax. Year to date for the hospital, we're at a $422,060 loss. Last year we were at $155,270. The nursing home seen about a $13,000 decrease in gross patient revenue. They ended up losing $41,509 for the month. Year to date, the nursing home's at a loss of $51,350 this year compared to a $39,544 loss in the prior year. The homestead gross patient revenue decreased, but the large amount. The reason for that is just the timing. We do get money from Meals on Wheels and the people that we serve at the jail, and that money did not come in this month. It'll actually be in next month, and that's the reason we've seen the decrease in the meal revenue from $11,000 down to $1,900. That's the reason they had a $967 loss this month. Otherwise, they would have had a net profit again. So next month, their net profit will be twice as much because of that reason. Year to date, they're at a net profit of $35,850 compared to net profit last year of $27,582. Page 10B is our statement of cash flow. You can see that our cash actually decreased from $283,067 down to $74,399 at the end of September. So spent more cash than we took in. Page 11 is your accounts receivable. It's almost identical to the prior month, really nothing there. Page 13 and 14 is your balance sheet. And pages 15 on back is all your statistical graphs. So if you have any questions on any of those, once you get a chance to review them, let me know. Or anything else.
I might just say from finance, the minutes are put in there each month of our finance meeting, and some of the things that we discuss about whether it's cuts or whether it's other ways to find, revenue streams, in places that we can increase in certain other areas. All things are being looked at. This month, was one of those perfect storms where all three entities, had negatives. You hope that that's not the case, in every given month, but this month, that's what happened. On top of that, from a cash standpoint, you had 3 payrolls. So that happens twice a year, so when that 3 payroll hits, that really means cash. So, but there's also another item that we'll bring up, towards the end, today, that also be hopefully, will be a savings as well, and also be better for the employees, so. Any other questions for Kevin? If not, thank you, Kevin. Next, Medical Staff Executive Committee, Chief of Staff, Dr. Kinsey.
All right, so the Medical Staff Executive Committee met on October 13th. Primarily, we recommended reappointment and appointment of several positions. We reviewed some QAPI, and then also reviewed some policies that need to be approved. So, number one, I move that we reappoint to courtesy staff Ricky Reeves, MD, pathology.
Second.
We have a motion by Dr. Kinsey, a second by Dr. Brown, to reappoint to courtesy staff Ricky Reeves, MD, pathology. Roll call vote, please.
Kinsey,
Yes.
Sanderson. Yes. Simon. Yes. Brown,
Yes.
Klein,
Yes.
Gaspard,
Yes.
Hannaford.
Yes.
We also move to appoint courtesy staff Colin McCarthy, who covered in the emergency room.
Second.
Who was the second? I'm sorry.
Me.
Okay, thank you. We have a motion by Dr. Kinsey and a second by Terry Klein to appoint to courtesy staff Colin McCarthy, MD, for the ER. Roll call vote, please.
Sanderson. Yes. Simon. Yes. Brown,
Yes.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey.
Yes. I also move that we reappoint to courtesy staff Sharita Wilson, MD, pathology.
Second.
We have a motion by Dr. Kinsey, a second by Dr. Brown to reappoint to courtesy staff Sharita Wilson, MD, pathology. Roll call vote, please.
Simon. Yes. Brown,
Yes.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson. Yes.
And finally, move that we reappoint to courtesy staff Barry Rockler, MD, pathology.
Second.
A motion by Dr. Kinsey, a second by Hayla Simon to reappoint to courtesy staff Barry Rockler, MD, pathology. Roll call vote, please.
Brown,
Yes.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson. Yes. Simon.
Yes. And that's all I have for medical staff.
Okay.
I have one more thing to add. We sat down with all of the providers and had come up with another cost savings that I did not tell you about that I want to explain. We were able to cut out one entire FTE and benefits by doing it this way. Jennifer Nichols in the ER, or in the urgent care, she works 8 to 4, Monday through Friday. After 4 o'clock, the ER provider takes over the urgent care, seeing the urgent care patients, also seeing the urgent care patients on Saturday and Sunday. There is a person on backup call. If the ER person does get slammed and cannot handle both, the backup person can be called in. And we're working on some bumps and trying to get that out. Mostly that's with our locums docs that we've had hired. We've had some issues with them, not understanding that they were gonna do both, but I think we've got that taken care of now, and that provided a huge savings for us in that respect, so I just wanted to let you know about that.
Okay. The next item is coffee.
So, the coffee committee met, you have your, the plan, essentially, and minutes in your, folders. There was no real urgent matters that we needed to cover, there was no major deficiencies found. It was business as usual.
Okay. Any questions in regards to that? If not, we will move on to improvement to patient care.
That me too.
Yes.
We reviewed the validation calendar, it's in your folder also, the contracts were all, had been reviewed by the CFO and were considered compliant. And then we moved on to, several policies and procedures that needed to be, reevaluated. We have to go over them annually. These policies had no changes, and I'll talk about the one that did, but initially, these had no changes. So we moved, I moved that we approve the central sterile policies and procedures.
Second.
Have a motion by Dr. Kinsey, a second by Dr. Hannaford, to approve the central sterile policies and procedures. Roll call vote, please.
Klein,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson. Yes. Simon.
Yes.
Brown.
Yes.
And I move that we approve the surgery policies and procedures.
Second.
Have a motion by Dr. Kinsey, a second by Terry Klein, to approve the surgery policies and procedures. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson. Yes. Simon. Yes. Brown.
Yes.
Klein.
Yes.
We also reviewed the list of committee directors, which is really where the staff positions oversee different committees, and we made those assignments. Does not look like that's up for vote, so, moving on, the influenza policy was changed this year to require all employees to get the influenza vaccine, or if they're hired on during flu season, to also get the influenza vaccine, and I move that we approve that policy.
Second.
We have a motion by Dr. Kinsey, second by Dr. Brown, to approve the influenza policy. Roll call vote, please.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson. Yes. Simon. Yes. Brown.
Yes.
Klein.
Yes.
Casper.
Yes. All right, anything else? All right, thank you very much. Next is the Sheriff Convalescent Home Report. Rita?
Yes, Christy, Williard, and I attended the LPN graduation that was held at Northwest Tech. We had several employees there that, may I say, Shore Medical Center has gained, and take care of them, all of us. And we have two going into the program that will start in November. We are learning who our new RN program students are. They've come on board and are working. Tammy Mustard had an in-service for combative elderly. We had a large water pipe leak in the west end, or east end, I think it was. And that was fixed, and lo and behold, 2 weeks ago, or we had another one, so they're in the works to fix that. Luck and Bills were here to, repair a fire alarm bell. While they were here to repair that, they found another one, so they were here today and, got that repaired. Our average daily census was down 1, as Kevin said. Our skilled days were down. It looks like October, our skilled days will be up. I'm not sure where it's at, but we've had quite a few skilled. We did send out letters for a rate increase that will be effective November 1st. A couple of feedback things, but other than that, not that important, I don't think. Dietary in September needed at least 1 full-time employee. They have filled that position and will be watching their overtime to decrease to help with finances. We have had a couple of changes in housekeeping to help also with finances. And we're still looking at reducing agency nurses. I can't remember if we had board meeting last time or not, but we did have our survey and we have our results, and our plan of correction has been accepted, and we're in the middle of providing the information and the documents that the surveyors will look at when they come back for our recheck, which should be sometime after November 16th. Let's see. The new MDS updates that affect the skilled beds and the hospital swing beds went into effect October 1st. We had a couple of glitches on conversion, but nothing that had a problem as far as submission or acceptance. And I do want to say, I can't thank the staff hard enough. They work hard every day, but during survey it is very stressful, and they worked very, very hard. And the residents were on best behavior. So, any questions?
Any questions? If not, Rita, thank you. Next, Kelly, SMC or the homestead. How about that? Let's do the homestead report first.
Okay. The homestead has been having a lot of interest, I guess, for people looking to move in. Right now, or at the end of September, we had 5 open apartments. We still have 5 open apartments. We do have 3 reserved right now for people that are move in, and we'll do so in the next few weeks. Also have another person that actually called today and wants to tour from Fort Gibson. And so they'll tour on the weekend, and she wanted to make sure that she could move in 2 weeks. I assured her that if she wanted to move in 2 weeks, we could make that happen. So, we have been evaluating our services to the residents, making sure that we're, just from a budget standpoint, making sure that we're doing, 1, what we say we're going to do as part of our rental agreements, but 2, if we're in any of those situations where we, go above and beyond for special requests and that kind of thing, making sure it's not having an impact on hours and that sort of thing. Like Rita mentioned, with dietary, we're also watching our spending and our hours, and I think we too have filled our positions to the point where we should significantly, if not completely, eliminate our overtime in the kitchen. We're fully staffed otherwise. We have had we continuously have this issue, and from time to time it's more of an issue, and we do have a few people that are dealing with issues related to aging in place that homestead is less and less appropriate for them to live at, but still working through where the next best appropriate place for them to be would be. So Rita's always good to work with us on stuff like that, and so things are going pretty well.
Kelly, I will say that I did talk to a couple that has been there maybe a couple of months. And he was just determined he was not gonna be happy there, and I was like, you just need to try it. And I think his wife said he gained 21 or 26 pounds.
And he needed it. He
He's
needed every one
happy,
of
he
those
gets to
pounds.
talk to people, and I think she was happy too, so.
I had, one of our residents, since he's moved in, mentioned how much more colorful it was in the dining room.
Oh, I'm
Yes.
sure. Colorful is the polite way of putting it.
So, yeah, another good success story. It's one of those, I always say people wait too long to come see what we're all about. And if I could, find that magic switch to make
Right.
people get out there and move in, I'd flip it all the time, because when people get out there, they like it. Very rare occasion is it not something that is suited for the people of our community. So, hopefully, if you look at our stats, you'll see we have a waiting list for 2 sizes of apartments, and hopefully, there'll be, very few apartments, without a waiting list in the near future. So, we keep moving in that direction, keep getting a little bit better. And right now, we are currently, 100% of our, residents, not including our staff that we have stay tonight, but 100% of our, rent-paying residents are, retirees. So, it's not been the case, in years past, so, good thing.
Any questions for Kelly? If not, Kelly, we can move on to the foundation report.
The foundation had its quarterly meeting, on October 13th. Compared to last year, our first quarter, fundraising, was, decreased, pretty significantly, but I will say that last year in the first quarter, we received, I think we received a $20,000 gift, during the summer months last year. We did not receive a $20,000 gift during the summer months this year, and so our donations are down. Our spending is, less overall, but we do show a loss, for the quarter, in year-to-date. We, have, increased our, assets in the Communities Foundation, which is our endowment, which is, what our foundation has set a long-term strategic plan of increasing that endowment to where it, becomes a, contributor to the medical center's operation over time. We're not near that point yet, but, we have had over a $25,000 increase in our endowment, as compared to last year, so that's good. You can see our minutes there, and I'll be happy to answer any questions off of that. But I'll tell you that we are going to have a special meeting again this week, some of it is to do some housekeeping, but we'll also be approving the Communities Foundation gives us an option to take a distribution every year, and we have the option of either rolling that back over into the Communities Foundation or accepting that distribution. With what we discussed last week with regard to funds for hospices, have been donor designated to benefit Share Medical Center hospice programs, being that we no longer offer hospice, or don't currently offer hospice programs. We've decided to put those assets in with our funds at the Communities Foundation so that they can act more as an investment and garnering more interest off that. Those funds combined with our distribution total more than $10,000. And so we're going to roll all those funds, write one check back into the Communities Foundation for that amount. And the Communities Foundation is going to give us $2,000 to go towards our endowment for a match. So that kind of affirms our belief that the Communities Foundation will be a good source for us to use as an investment and for our endowment funds. And so we're glad of that. Some other things, we will be getting a new board member and saying goodbye to, we've said goodbye to a board member. Terry Klein was one of the hospital authorities representative on the foundation board, and he served as chairman recently, so, we did appreciate Terry for his service, and he got one more free meal out of the foundation. That's good. I'm happy to answer any questions on the foundation.
Any questions for Kelly? If not, Kelly, thank you. Next, Bridget, St. Anthony's report.
Okay, just a few items, and the next couple of days, we're gonna be celebrating Spirit Days in Oklahoma City, and we invite the affiliate partners to participate with us in that event. It's just a day to reflect on our mission, and then also, we have some motivational speakers, and a movie, and do service awards, so it's just a fun day for the employees. The week after that will be the OHA convention, so we're also having an affiliate appreciation event, and this year we're gonna have it at Topgolf, so hopefully that's fun. Usually we just eat
Sit around.
and have some beverages, but this time we're gonna have some fun, so, hopefully that'll be a good event. I did bring y'all some trustees education. I know everybody loves education, but we did purchase, this year. There have been several requests from the CEOs to get some, education material, so we thought we'd try this out this year, so we brought you some samples and some books and stuff, so if it's something that y'all want to participate in or interested in, you're more than welcome to those materials. We are continuing to work on some CME opportunities. In the past, we've had an annual summit that we've put together, for the physicians, and then some administrative type things that we've run kind of coincide with that. We realize, this year that everybody's kind of confined, and it's getting harder and harder, particularly if you only have a couple of physicians to pull them out of the hospital for a day. So we're not gonna have the annual summit this year, but we're gonna come up with some alternatives to that. So we hope to have, like, once a month, have a CME opportunity that's available. At any time, they're welcome to come to the city and go to any of our CME grant rounds that we have. But we want to try to find a way to deliver something each month, maybe during the noon hour for an offering,
Like a
understanding.
telemed.
Yes. Just understanding that we know it's harder and harder. A little work on your end, cause you'll have to do a little packet to get some things returned, but, we certainly wanna make that an offering and see if that'll be a good option for an alternative. It's harder for everybody to get out. There's too many things going on, yes, and it is expensive, particularly for so far.
Right.
So, and just in general, just to say that I know that, so many hospitals are in financial distress. I sit on 7 different boards, and so I see the same thing over and over in these hospitals. So we're all in the same boat together, and so we're working diligently to make sure that we can share our resources and try to do all the things possible to make sure that your hospitals are strong. So, any of those things that the hospitals can tap into from our facility, we certainly want to try to help. We had a conference call a couple weeks ago, to start strategizing on how we can get some additional, specialty outreach opportunities. And we had St. Mary's on the phone as well, for their business development department and our business development department. So we will work very diligently to try to make some of those things happen. So if there's things that you think we need to work on from our end to support, please let us know. We're happy to do what we can.
All right, any questions for Bridget? If not, Bridget, thank you.
Welcome.
Next, from the city council report.
I apologize, but I was sick that day, so I have no report.
All right, fair enough. Saves us 5-10 minutes. Thank you.
Now, they can't have these, can they? They just look
You
through
need
them
to
and-
check them in and out,
Okay.
because we have one set. Well, we have 2 sets. of
You do
them,
have,
but
okay.
We have 2 sets, yes.
Okay,
They
we'll
want
talk
to.
about that.
Yeah.
We'll try.
Okay. Next item is chairman's report. I have one item of business. There are 2 folks that we as a board approved to serve on the foundation, and with Terry stepping down, we need to replace him, and we bring to you Dr. Yvonne Carmichael to serve on our foundation. And so we need to vote to approve her, please.
Make a motion to approve Dr. Yvonne Carmichael as one of 2 AHA representatives on the SMC Foundation Board of Trustees.
Second.
I have a motion by Dr. Hannaford, a second by Hala Simon to approve Dr. Yvonne Carmichael as one of 2 AHA representatives on the SMC Foundation Board of Trustees. Roll call vote, please.
Kinsey,
Yes.
Sanderson,
Yes.
Simon.
Yes.
Brown,
Yes.
Klein,
Yes.
Casper,
Yes.
Hannaford.
Yes.
Okay. And then under new business, this was just given to us today. It's that time of year again, and if you've been watching on the news, I know it came out last night, and some of you may even be seeing this, but about health insurance and increases in health insurance. And our Blue Cross Blue Shield notice was going to be a 25% increase for us here at the hospital. And so Kevin worked diligently to also find other ways that we might be able to save money on that and possibly get something that's better from a standpoint of the high deductible that we've had in the past. Kevin, I'm probably speaking out of turn. Maybe you ought to speak on what you found.
Sure. One of the options is Health Choice is an option that we actually went out and we talked to them, and Rick kind of reviewed it, and we're actually going to send an application in for that. But what it's going to allow us to do is, one, give our employees a deductible that's now $5,000 down to a $1,500 deductible, plus it's also going to save the hospital money as well at the same time, so we won't actually see an increase in our premiums. But that being said, we have to have a board resolution requesting to be part of their group. We have to actually have that as a board request. And I'd like to do the health insurance, the life insurance, the vision, and the dental with them. It's a good option for us. It's gonna be significant dollar savings for the facility. We have to submit that, then they have to approve it, and that has to be into them by the 31st. If they can let us know, and we should be effective January 1. When I talked to the person on the phone, they were not very concerned about us not qualifying. So.
Okay. So we need a motion to approve for us, or a resolution for us to enter into a contract with EGID to provide coverage for health, life, vision, and dental insurance.
Is it actually a contract or an application?
It's the application that will actually be, but once we do that, once we make the application, then we're bound to go with them.
So really the resolution is to authorize CFO, CEO to make application and to pursue a contract with them for these health benefits. Is that, am I getting that
Right, that's correct, yeah. That's what we have to have.
And just so you'll know, if Paul's gonna do business, because this was something that came after the agenda, but something that needs to be addressed before the next meeting, and the possibility even of a special meeting. So, it appears to be appropriate.
Okay.
Now, is a resolution to apply sufficient? Or don't we need something that says we're going that way?
I think you need a resolution to apply, which is authorization, which means you're going to engage them.
What does that actually say from her?
It says, a board resolution showing the authorized authority has approved their request to pick up coverage through EGID.
That sounds like a great motion.
That's what I was gonna say, is that a motion? Can we vote on that?
We vote on that.
Like he said.
move that we approve, I move that we approve the request for the CEO and CFO to pick up coverage through EGID for health, life, vision, and dental.
That work?
Second.
Dr. Brown has a second.
We have a motion by Dr. Kinsey, a second by Dr. Brown. Did you write that out?
I haven't done it yet.
She recorded.
To approve, I think it was the CEO and CFO.
Approve the request for CEO and CFO.
So, to secure coverage through EGID for health, life, vision, and dental insurance. That close?
Sounds right.
Roll call vote, please.
Sanderson?
Yes.
Simon?
Yes.
Brown?
Yes.
Klein?
Yes.
Gasser?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
All right, thank you for that. One last item. Terry, I want to say thank you for your years of service and for serving not here only for AHA, but being willing to serve in the community. And thank you, we'll miss you, and we wish
Thanks.
you well.
I'm not going anywhere.
I know, but you're not going to be here with us.
Is there money in here or what?
Are you kidding?
Oh, you think there's a paycheck at the end?
You
That's why
missed
you
today's
quit.
finance meeting.
Yeah, there you go. But thank you.
Thank you, appreciate it.
Thank you, Terry.
I really enjoyed it. When Arden first told me about this opportunity, he didn't really expand on it too much. That was
There's a
probably
reason.
for that. But it was really after coming from the military and retiring back here, and it really helped me kind of engage with the community, and it was really something that was good for me and my family, and I really enjoyed working with everybody, and so I appreciate the opportunity to kind of get in on the ground and help out. I know that now more than ever that working in a hospital environment is a very, very difficult thing when it comes to the funding. It probably is for the other things that they do too, but having seen it from the level that I've seen it now, it's very, very challenging. And I'm just very hopeful that we've kind of turned a corner and that we'll start seeing some very positive things here on the financial side. Hopefully the UPL will help us out. It's looking very promising, and I'll be interested to
I
see
hate
how
that you're not gonna be here for that because
That's
you
okay.
had, that has been your
I'll
baby.
be rooting from the
Okay.
stands. Yes, so, but thank you all, thank you, I appreciate it, and good luck to everybody.
All right, thank you.
You can come back and visit anytime.
I will.
All right.
And free food.
I think we are adjourned. Thank you.